idea to have to hire all these new IRS workers?
No.
That's what we just did in this bill. It's a mistake. The bill was a mistake. It was a mistake, and if you go to try to fix it now, you say, well, okay. The first thing you got to recognize is the fact that it's already a deficit buster, as it is. You know, the current member, he'd say, well, the CBO said, you know, after this thing passed, there was $300 billion that was added right away to the cost of this bill, and the fact that the assumptions underlying this bill really were wrong. Yeah, does anybody believe that we're going to cut 22% from doctors' pay?
Yeah.
I mean, so, but yet, you know, this is, well, you know, does anybody think it should happen? I'll tell you what, you know, I mean, this is, doctors haven't had a raise in terms of their Medicare, Medicaid payments since 19... Yeah, so you know, they can tell it firsthand. But yet this is an assumption of the bill. The other thing is, none of the analysis include anything about the second order effect. Right now, you probably know, I've been listening to, I know I've heard it, there are businesses, and McDonald's was in the news last week, there are businesses that are considering dropping coverage, right, and then pay a fine. And then basically the cost gets socialized over 300 million Americans. That's not factored into the cost either. I'm bringing that up because this bill is, you know it is, it's absolutely a deficit buster. Now when you go to try to fix it, you're going to incline towards the most you know, difficult, onerous aspects. Well, as soon as you do that, it's a house of cards. You start taking out, the bill falls because it's not able to pay for itself. And another issue that people are struggling with right now. So this is why I believe we need to start over again. We're going to have to repeal that. Now we need healthcare reform. We've got to have it because it's among the three things that I consistently hear from small business owners and their employees. It's taxes, regulation, and healthcare costs. So we need healthcare reform. And what I think we need to do is start by a very tight bill, not a huge, comprehensive 2,700-page bill, but a bill that tries to drive down costs by you know, employing more free market forces. The first thing is access to insurance companies across state lines. And we do this for automobile insurance now, but yet we don't do it for healthcare because we're prevented from doing that from law. We should take down that law and allow us to have access to insurance companies across state lines. We should have more understanding and transparency and accountability for costs in there. And right now, if you think about it, you learn about your healthcare when you get that summary of benefits and the copay. But really, we're not involved on the front end in terms of understanding costs and pricing and the like, and in terms of even having incentives for, you know, keeping our blood pressure and our cholesterol so that we get rebate from insurance companies. We can have these things. Tort reform. Tort reform is going to have to be included in this because it's part of the instability, the uncertainty in the system. We're going to need to do it. And you know, states have done this. Texas has done it. California has done it. States that have implemented tort reform have gotten control of costs. They begin to bend costs down, and that's important. Doctors see this, and then doctors flock to states like this. They want to do that. It's not only important in terms of the premiums, because you know it's not uncommon for doctors in the greater Albany area to pay over $100,000 in medical malpractice premium for their insurance, but it's also combating the defensive medicine practices, the rife testing that is that goes on because of the concern of being sued. So we're going to have to do tort reform. These things, those actions are that's what's going to help our small business owners increase their bottom line. The tax regulatory relief, repeal and replace the healthcare bill. When small business increases their bottom line, they're in a position then to recapitalize, buy new equipment, and expand and create new jobs. But that's not enough because we know that 2/3 of our economy is consumer spending driven, us, right? So with the tax and regulatory relief and the healthcare repeal and replace provides more disposable income for us. Put them together. That's what's going to grow the economy. That is what's going to grow the economy, not Washington, D.C. You know, not that so-called stimulus bill. How'd that work out for us? It didn't. It didn't work out.
Hey, we own a car company now.
Well, you know, the thing of it is that we needed to restructure. We needed to restructure, and we didn't restructure. That was the problem. And So look, the first step towards a balanced budget is to grow the economy. Because any attempt to try to balance your budget when you're paying near 10% in unemployment and social services attendant to that, and you're not gaining receipts, you're not going to get there. So you got to grow the private sector economy, number one. The second thing is we need to roll back all that discretionary spending that occurred here in the last 18 to 20 months. And then third, I believe we need to consolidate. We need to consolidate. Our government is too big. It is too big right now, and because of that, we are paying for too much in terms of salaries, benefits, pension obligations, and you got to fit them into a building. So you're paying for buildings, you're paying for operations and maintenance. We need to consolidate. We need to take a hard look across our federal government in areas that we have too much of it, and we need to bring it in line. And I will tell you that, give you an example. And you know, one of the things my opponent has been saying about me, and we're going to talk more about that in a second. But you know, he says, "Well, I'm gonna hurt your education and everything like that." Well, first of all, let's recognize the fact that I came through public schools, and that Mary Jo and our kids go to public schools. So our kids mean everything to us. We're not going to do anything against the public school systems. What we're saying is this current system is flawed. It's deeply flawed. And by the way, we created the Department of Education in the late 1970s. You think we're getting better or worse since then?
Worse.
We're paying for that. We're paying for that. Okay, so when he runs these ads and he says, we're going to hurt, our campaign is going to hurt the public education, it's 180 degrees out from where we want to be going with this. We recognize the fact that every day school boards, PTAs, teachers, administrators, students, and parents are trying to work towards excellence in education. That's where it is. That's the center of gravity for education right there. They need help. And the help they need is not from Washington, D.C. You think about it. Every dollar we send to Washington, D.C., we're lucky to get 80 or 85 cents back. You don't get that whole dollar back. You send it down there. So anybody who tells you the answer is federal funding, that's discounted. It's discounted because that's our money to begin with. Everybody recognizes, right? The federal government has no money. They have our money. That's what they have. They have our money. So why would we ever want to sign up for a system that sends money to D.C., gets chopped off and discounted, and comes back, and we say that's our system to fund? That makes no sense. That makes no sense, right? Now, you talk about supervision and oversight. I want to tell you that it makes sense to me that we would have a state-level Department of Education. I'd like to explain why. I mentioned that we every day it's at that school board and it's at that school level that we're trying to pursue excellence. But you know what? Every agency needs to be checked. It's the same fundamental principle from our Constitution. You need a check. You need that check. So to me, it makes sense that you would have a checker, you'd have a supervisory at the state level. But do you really need checkers for checkers? I don't think so. I mean, it sounds like a Monty Python film after a while, right? The sackers have been sacked and the sackers of sackers have been sacked. So that's why I believe that we can do better by consolidating, all right? And I'll tell you something else too. What's really needed is property tax relief. That's the problems we're having with the schools right now, among other things, deals with the fact that we're under stress because our property taxes are so high. And one of the ways that I think we can address that is by tying together that issue with energy. You look at energy, and energy, of course, is an issue here. And I think that, and after having studied this, and while I support an all of the above energy approach, it's important to look across the spectrum of possibilities. I think nuclear power is the way to go for us to help us as we go forward. I have studied this. I believe it to be safe. I put my name behind it. I put my name, my service that you value, I put my name behind this. I believe it. And why that's important is it not only will give us clean and abundant energy. When we construct these nuclear power plants, that's jobs for construction, but also that's the potential for the tax credits back to the school system that's going to relieve the pressure on the school boards. You see how that's tied together? That's the creative way to get after this. Not by some fear-mongering from my opponent who says something about DC money that we sent there in the first place and now we're expected to get 80 cents back. That's not going to solve our education woes. It just isn't going to happen. So don't believe that. So our campaign is about growing the private sector economy. It's about balancing our budget by reduced federal spending, and it's about protecting our freedoms. Protecting our freedoms from threats from abroad and from encroachment here at home. My opponent. Now, my opponent says he's a fiscal conservative, right? But let's look at the facts, because he has a voting right. Let's look at the facts. The facts are that he votes with Speaker Pelosi nearly 90% of the time. Now look, Speaker Pelosi, you say what you, she is an economic liberal. She'd be in her defense, she'd be the first one to say that. She'd be the first one to say that. The problem is my opponent says he's a fiscal conservative and votes with her nearly 90% of the time. And it's hard to believe he did that much damage in the short amount of time he's been there. You think about what he voted for, right? He had the first health care vote right. And then under pressure, he flipped. He flipped under pressure from Speaker Pelosi and President Obama. He flipped his vote and he voted for that bill, not an economically and fiscally conservative bill. He voted for cap and trade. You vote for cap and trade and you're from here, I don't understand that. I don't understand how somebody from here, representing us, and you know, when he casts a vote like that, he speaks for all of us. I can't imagine us casting that vote. You know, that is a bill that climbs up on the back of farmers and manufacturers and says, you're going to pay for this transition, you're going to pay for alternative energies. Why would we ever want to do that? We have the smartest and hardest working farmers, manufacturers in the world. Their problem is profitability. So why would we ever sign up for some kind of concept where we've got a cap and anything above that you're going to have to pay a tax or go on the market and trade? It's basically a tax. You have to pay for that. Why would we do that? There are smarter ways to balance the environment and the economy. I just gave you one moments ago. There are smarter ways to balance the environment and the economy. You know, even the Senate Democrats walked away from that. They looked at it and said, you know what, that's too radical for us. We're not going to do that. But yet the House passed it, and it passed with NY20's vote. That's unbelievable to me. And he needs to be held to account for that, and held to account for the health care bill.